now we have a family coming in and the patient's already dead. How can we make it inviting for them to come in and make it what a horrible experience it's going to be already, to try to make something positive out of this. So decedent care is another handout that we've created that's included. And presenting the body with head bed up, discontinuing the tubes if it's not a coroner's case, leaving the hands outside the blankets, putting the rails down, getting chairs close so the family comes right in and wants to touch their loved one. Again, being aware of cultural considerations. We have started memory kits in the ICUs. So we have a memory kit box. And this was a big project that Joe Scott ended up putting together for us from TICU. And in it is bags for families. We have some of our Buddhist cultures insist that we keep lights on, and they brought candles in to light. And we had to say, no, you can't light those. So now we have flameless candles. We have ribbon to cut a hairlock. We have a clay for a hand mold. So at first when we brought these out, a lot of nurses thought these were kind of hokey. Isn't that for babies? Why would we want to do that? But what we found is that if it is a parent and there are young children at home, to be able to provide this for the children means a lot to the family. They can paint it, they can color it, they can do whatever they want to it afterwards. It dries but it doesn't harden, but it's something, it's a keepsake for children. We've had teenagers die in our units and younger siblings. One in TICU, we had one patient that had 3 younger siblings. We ended up giving them 3 different handprints because it just meant that much to them. We're also trying, it's up to every unit with their palliative care representative to get an address to send them a follow-up sympathy card in a couple of weeks. So you go in, we have an address book. We explain what we would like to do. We put the patient information down, and we try to get, in a couple weeks, get the card out, have staff sign it, staff that have been actively taking care of the patient, physicians, nurses, whoever, and then send it off to the family. Also in here we have bereavement information. So these purple social services has these, and some of the units have these, but it's just how to take care of yourself after a death. Also in the ICUs, we've got information on mortuaries and hotels. Sometimes we have traumas, we have people coming in from out of town.
Do they come in different languages?
Yes, Spanish and Vietnamese also, yes. So the med-surg areas have just created their own boxes and have memory kits. The nursing office has a few kits. So if deaths happen in other parts of the hospital and you're involved and you want to make a difference, you feel like this is needed, come to one of those areas. So, one of the patient stories that I did want to share was I took care of an ICU patient it was a couple months ago, and she was young, she was 30. She had had a major stroke and had died fairly quickly, but she had long, beautiful, wavy brown hair. And when I brought the memory kit in with the ribbon, the family just went from, it was horrible. It was a horrible situation. From being very teary-eyed to having something to do, that they could leave with something positive. And they ended up cutting like 8 pieces of hair from her, and I just kept giving them ribbon strands. And it was something that they could really hold on to. She also had a 10-year-old boy, so they took a handprint also. So it does make a difference. Okay, sorry.